Imagine staring at a jagged stone blade, knowing it's about to scrape directly into your skull. No anesthesia, no antibiotics, no sterile operating room. Yet, 9,000 years ago, prehistoric humans didn't just endure this brutal brain surgery, they survived it. Today, a scratchy throat sends us running to the local pharmacy. But for 99% of human history, there were no doctors, no hospitals, and no search engines to diagnose your symptoms. If you got sick or injured, you were entirely on your own in a wild, unforgiving world. Yet, our ancestors didn't just collectively drop dead the moment they caught a pathogen. They survived, reproduced, and built civilizations. How did they pull off this impossible feat? The secret lies in a massive, chaotic, thousands of years-long clinical trial, where the sample size was all of humanity. Ancient populations weren't primitive or clueless. They were hyper-observant survivalists who traded written medical textbooks for an equally powerful asset: deep, generational trial and error. Take the Neanderthal burial site at Shamans Cave in Iraq. Archaeologists discovered massive concentrations of plant pollen deliberately placed inside a grave dating back 60,000 years. These weren't random weeds. They were specific plants like yarrow and ephedra, botanical species still actively utilized in herbal medicine today. Neanderthals were practicing advanced pharmacognosy before modern humans even arrived in the region. Once modern humans took the reins, this botanical toolkit exploded. Across completely separate continents, ancient healers independently discovered that chewing willow bark radically reduced pain and fever. They didn't know the bark contained salicin, the exact chemical blueprint for modern aspirin, but they understood cause and effect. They discovered that garlic acted as a potent antimicrobial, that turmeric slashed inflammation, and that echinacea supercharged the body's defenses. They weren't just blindly chewing roots either. They formulated complex preparation methods, drying, boiling, and combining dozens of ingredients in precise ratios to maximize absorption and neutralize toxic side effects. This was empirical pharmacology, without the lab coats. If you want to uncover more hidden human history that challenges everything you thought you knew about our past, make sure you're subscribed to the channel. We drop deep dive visual essays like this every week. When it came to acute trauma, the strategies became even more ingenious and graphic. In a world of hunting accidents and warfare, a deep laceration was an immediate death sentence via infection. To combat this, the ancient Egyptians weaponized honey. Because honey features a low pH, high sugar density, and naturally secretes trace amounts of hydrogen peroxide, it creates an environment where bacteria physically cannot replicate. Other cultures utilized specific mineral-rich clays to draw out toxins, or applied spider silk directly to open wounds, accidentally capitalizing on the high levels of vitamin K woven into spider webs to instantly clot blood. And when infections turned gangrenous, they turned to maggot therapy. By introducing specific fly larvae to a wound, ancient healers cleaned deep trauma with microscopic precision, as maggots exclusively consume necrotic, dead tissue while leaving healthy flesh completely untouched. But nothing compares to the jaw-dropping reality of prehistoric surgery. Skeletal remains from across the globe reveal that trepanation, the physical act of drilling or scraping holes directly into the human skull, was remarkably common. Even more shocking, the bone tissue shows distinct signs of long-term healing. Patients lived for years after these procedures. To put their success into perspective, consider this. Modern antiseptic practices didn't become standard until the 1860s. In the 1840s, European hospital wards were so incredibly unsanitary that surgical mortality rates were drastically higher than those on primitive battlefields. An ancient surgeon operating outdoors with a clean, freshly napped obsidian blade likely provided a far more sterile environment than a prestigious 19th-century London hospital. Beyond external tools, our ancestors carried a devastatingly powerful biological weapon, an evolutionary hardened immune system. Exposed to a relentless barrage of pathogens from birth, the survivors developed unparalleled immunological resilience. While brutal, this natural selection created communities with potent herd immunity. Furthermore, their gut microbiomes were drastically superior to ours. Living in constant contact with natural soil and consuming a diverse diet of wild plants and fermented foods, loaded their digestive tracts with beneficial bacteria. Modern studies comparing industrial populations to modern hunter-gatherers reveal that our obsession with total sterilization, processed foods, and overprescribed antibiotics has absolutely decimated our microbial diversity, directly contributing to the modern explosion of autoimmune disorders and allergies. Ancient medicine also expertly manipulated the human brain through the placebo effect. When a tribal shaman conducted a highly intense, coordinated ritual involving fire, chanting, and community participation, it wasn't just performance art. Modern neuroscience proves that these high-belief environments trigger massive physiological shifts, plummeting cortisol levels, altering pain perception, and kickstarting the body's internal healing mechanisms. Of course, ancient life was undeniably brutal. If your appendix ruptured, or if you faced severe childbirth complications, your chances of survival were exceptionally low. Infant mortality rates skewed the average ancient life expectancy down to just 30 or 35 years. But if an individual successfully managed to survive the gauntlet of early childhood, it was highly common for them to live vibrant lives well into their 50s, 60s, or 70s. Ultimately, our ancestors survived because they were never truly without medicine. They possessed an intricate understanding of nature, highly responsive immune systems, and above all, an unbreakable reliance on community care. They looked at a harsh world engineered to kill them, and through sheer observation and relentless creativity, they engineered a way to keep the human story alive.